Good morning, everyone, and thank you for attending Apex Benefits Healthcare Reform Webinar Series Session 3. Today we're going to focus on the financial impact to the large employer market. Similar to how we've started our webinars in the past, Apex Benefits takes a strategic approach to helping employers understand the landscape, analyze the financial impact, determine the company and employee impact, and aligning that with business strategy, recognizing that there are tools and resources needed for all. Today we're going to focus on the financial implications to healthcare reform. We're going to analyze the impact, understand what your options are, considerations for have you done the math, what is the estimated household income distribution, what is the potential impact of healthcare reform and the impact of in and out migration specifically due to healthcare reform. What are the tax implications of your decision? And with healthcare reform, what is the future viability of your health plan? So to begin with, just to set the stage to determine who actually falls into that large employer category. So a large employer is defined by having 50 or more full-time equivalent employees. So that's going to consider both in determining whether or not you meet that 50 full-time equivalent threshold. It's going to be a combination of current full-time employees and then your part-time employees. There's a calculation to determine how many of those would be considered a full-time equivalent. So for that definition and determining the number of part-time employees equaling a full-time equivalent employee, the total number of service hours divided by the total number of non-full-time employees by 120 will give you that number. If between the number of full-time equivalent employees and your existing full-time employees exceed 30 or more, you will be subject to the employer mandate under the Affordable Care Act. So what does the employer mandate mean? So first we're going to talk about pre-healthcare reform. So pre-healthcare reform is really an employer's choice to offer health coverage without penalty. So they can determine whether or not they want to offer coverage to all or a portion of their employees. They can define who an eligible employee and dependent are, specific to their health plan. They can determine the benefit waiting period. So how long must an individual work for that employer for a specific number of hours before he or she becomes eligible for the health plan. Employers also have discretion over benefit design. Are they going to offer a traditional PPO plan, or are they going to offer a consumer-driven health plan? Employers also have the ability to designate what the premium contributions are, so that employers are able to determine what portion an employee must pay out of his or her paycheck to pay for health care coverage under the plan. Post-reform, there will be many changes beginning in 2014. So with the Affordable Care Act and a large component of that being an individual mandate where without few exceptions, or with few exceptions, individuals must obtain health care coverage. That translates into the large employer market as well. It translates in terms of shared responsibility and penalties that may be applied if an employer does not offer coverage to at least 95% of full-time employees working over 30 hours. So employers can no longer dictate that eligibility status of how many hours a person must work per week to be eligible for benefits. Coverage must also be affordable. Affordable is defined as employee-only contributions being less than 9.5% of that employee's household income. The plan also has to meet a certain actuarial value. The minimum actuarial value requirement for large employers beginning in 2014 is 60%. And in essence, what that really means is based on the deductibles, co-pays, co-insurance, and out-of-pockets, on average, the employer's plan will cover 60% of those costs, leaving 40% to the employee. There's also a limitation on the waiting period. So currently, employers can dictate how long an employee has to work at the organization before they become eligible for coverage. Beginning in 2014, that waiting period is limited to 90 days. There are safe harbor mechanisms that can be put in place to allow for measurement and stability periods in determining the hourly workforce. So if you're trying to determine whether or not an hourly person really works 30 or more, or if they're truly working 30 or less, there are some rules and regulations on how that can be applied. And then also in the post-reform environment, in order to meet the qualifications as for shared responsibility, an employer must offer coverage to dependents. So they don't have to financially subsidize the coverage for dependents, but they need to offer coverage to the dependent children. The regulations have recently confirmed that that does not apply to a spouse. So what are we going to talk about today? We'd like to focus on an employer's call to action. So why should an employer undergo a healthcare reform, what we'll call an impact study? So why should an employer take a step back and look at the financial implications of healthcare reform to their employer-sponsored health plan? Well, all employers are faced with budgeting. They're faced with looking at benchmark plans relative to the exchanges, relative to their peer groups that they're trying to recruit and attract key talent from. And they must be able to communicate the value of their plans relative to their employer-sponsored coverage, as well as helping employees understand the value of coverage within the exchange market. Why are employers at risk? So why should they be looking at a financial study? What are some of the risk factors that they need to consider? Do they currently have low plan participation? Do they currently not cover all full-time employees? So some employers may cover employees working at least 40 hours a week, but they may have a significant portion of their population working 30. Moving forward, those individuals are going to need to be taken into consideration for health plan eligibility. Is the employer plan below minimum value? We talked about this, the 60% actuarial value. On average, the deductibles, the coinsurance, the copays, is the employer paying on average 60% of those costs? Is the coverage unaffordable? Are employees paying more than 9.5% of their household income for employee-only coverage? Are you a magnet plan? Are your benefits so rich and so affordable that you're going to essentially attract more spouses and dependents onto your plan, therefore posing greater risk for increased costs? And then what is the likelihood of excise tax penalties? So in 2018, if your plan costs exceed certain thresholds, there is a 40% excise tax penalty imposed. So as we look at categorizing and assessing the employer risk factors, we can really look at two buckets. The in-migration risk, so you look at low plan participation, and if coverage is not currently being offered to full-time employees working greater than 30 hours per week. Looking at, is the coverage unaffordable? What is the employee's income level and marital status? Would they qualify for Medicaid coverage under the exchange based on their household income? Will an employer reduce hours to put more employees into a part-time status? So will they limit the number of hours being worked so that they can avoid individuals working over 30 hours a week, therefore qualifying for coverage and facing potential penalty? And then what is the cost of offering coverage? With all of the fees and tax assessments and other financial implications that we'll talk about today, how will those costs impact the financial viability of your health plan? And what are some compliance risks? Is your coverage below minimum value? Is your coverage unaffordable? Do you need to increase your benefits to meet the 60% actuarial value? Will you have cost savings from in and out migration into your plan? So with the individual mandate, it's safe to assume that more individuals will be considering enrolling in your health plan. With that being said, will individuals opt out of your health plan because it may be more affordable to get coverage elsewhere? And a compliance risk of penalty exposure. If you're not meeting certain requirements, what is your risk for penalty? Other cost drivers, as we've mentioned, fees and taxes. You have the health insurer assessment beginning in 2014, and these particular fees begin in January of 2014. So regardless of what your plan renewal date is, you should know and make sure to factor the financial costs beginning in 2014. You also have the Transitional Reinsurance Program. That's a $63 fee per member covered under your plan, so per belly button covered under your plan, for lack of a better word. That will begin in 2014, and the intent of the transitional reinsurance fee is to help fund the exchanges through a tax assessment being applied to employer-sponsored coverage. That fee is due to phase out in 2016, so that will decrease over time, but that is a cost directly to employers that they will be charged either through their self-funded plan that they will need to account for, or if they're fully insured through the insurance carrier. And then we also talked about the excise fees in 2018 should your plan exceed certain costs. You also need to consider premium and trend escalation, pent-up demand for services beginning in 2014. So we have a significant portion of our population that's currently uninsured. Beginning in 2014, as the individual marketplace changes, as there are federal subsidies that can be gained to individuals or provided to individuals to purchase health care coverage onto the exchange, we're going to have additional utilization. We're going to see additional utilization both at the facility and provider level. As a result, you'll probably see some provider cost shifting. As more individuals qualify for Medicaid, employers will see a lower reimbursement cost with Medicaid compared to employer-sponsored or commercial insurance. And then you'll see health insurers shift costs as additional fees and taxes are imposed by the federal government to health insurance companies. Those health insurance companies will leverage those fees and push them down to employers. So as we start to take a look at some additional detail or more specific detail around analyzing the financial impact, there's really 4 key items we want people to take away. Looking at the financial projections, identifying what the healthcare reform cost factors are, understanding the plan actuarial value, and how might you consider plan design changes to either meet the minimum actuarial value or recognize that there may be opportunity to help mitigate some of your costs through plan reduction. And then looking at the employee impact, something that employers need to consider. As a result of healthcare reform, there are significant costs that are shifted to the employers. But in light of that, there will be costs shifted to the employees. As benefit changes are made by employers, as employers drop coverage, what would that mean to the employees? What are the estimated costs within the exchange that the employees might see if they want to purchase coverage on an individual basis? So as we look at quantifying the cost drivers, this is a sample of part of our impact study that we look at each factor within healthcare reform and over the course of time estimate the impact to the employers. First, we'll see subsidy out-migration savings and Medicaid out-migration savings. Are you an employer that has employees in a particular income category that may leave your health plan because there's a more cost-effective alternative for coverage, either through the exchange or through Medicaid? So the state of Indiana has not determined whether or not they'll expand Medicaid, but it will be important for employers to keep a pulse on that, because should the state decide not to expand Medicaid, there is a portion of those employees that could have qualified that will still need to consider employer sponsor coverage as means of meeting the individual mandate. You also have dependents to age 26. We recognize that this provision has been in place for a while, but it's also important to know that we would suspect that more dependents under the age of 26 will migrate to employer-sponsored health plans. As underwriting factors change in the individual marketplace, the young, healthy individuals will be most significantly impacted by those costs. Therefore, it may be a more reasonable alternative for them to be covered under a parent's plan. You also need to look at the enrollment in migration. Auto-enrollment in the individual mandate will drive individuals to seek coverage through their employer. Adverse selection is the current population that's uninsured or not participating in your health plan of more or less risk to your plan relative to their health status. And if those employees migrate onto your plan, will they have an adverse impact to the cost of your plan? Employer penalties. It's important to recognize if you have individuals that have unaffordable coverage or coverage that does not meet the minimum actuarial value of 60%, and those employees seek coverage through the exchange and qualify for a federal tax subsidy, you as an employer could be faced with penalty. You have benefit mandates. As we move forward into 2014, there are benefit changes and modifications that an employer will need to implement within their plan that will pose additional costs. We've talked about the healthcare reform pass-through fees and taxes. That will have a significant impact on employer-sponsored coverage beginning in 2014 moving forward. You have the Cadillac plan excise tax. Is your current benefit plan going to exceed the thresholds in 2018 and face possible excise tax in the amount of 40%? Will you see provider cost shifting? So to the extent that the market changes and providers, whether it's the insurance company or doctors and facilities, as their means of income and billing practices change, how will that impact employers? So in this particular case study, so this is an actual client that we looked at the demographics of their population and determined the different elements of impact as a result of healthcare reform. You see in 2014 that through healthcare reform alone, the employer's costs are going to increase almost 15%. The largest portion of those costs, as you can see in this particular example, is due to the in-migration. So this particular employer has lower than average plan participation. So as a result of auto-enrollment in the individual mandate, we suspect that the employer is going to cover a significantly higher number of employees on their health plan beginning in 2014. Other cost drivers include the healthcare reform pass-through fees and taxes, as we talked about, the transitional reinsurance fee and the health insurer's assessment. And then moving forward into 2018, we see an even higher jump of almost 30% in cost change as a result of healthcare reform. So as we talk about the plan actuarial values, you'll see the red line indicated here at the bronze level. So the actuarial values coincide with the plans that will be offered in the either federal or state-based insurance exchanges. The bronze level equates to the 60% actuarial value, silver at 70, gold at 80, and platinum at 90. And this is a specific employer case study that we performed and looked at the three benefit options that the employer had. You can see here that they all meet the minimum actuarial value, so they're all in excess of 60%. But it's also important to know that for all three of the plans, there's room to make benefit changes to help in mitigating some of the costs moving forward. As we look at the employee impact, we had talked earlier about the employer's need to recognize not only the cost to the organization, but the potential cost to employees. In this particular case study, part of our process that we go through is stratifying the existing employee population to understand, based on salary and estimated household income, how those individuals fall across the different federal poverty level buckets. So in this case, this employer had 77 employees under 139%. So in the event that Indiana were to expand Medicaid, these individuals would be able to migrate off of the employer-sponsored plan and would be financially advantaged in doing so. So as we look at the chart here, the blue bars represent employer-sponsored coverage. So the costs that are represented here are made up of the employee premium, so what the employee pays out of their paycheck for the employer-sponsored coverage, as well as, on average, their portion of deductibles, copays, and out-of-pocket expenses that they pay for their employer-sponsored coverage. So as we look at the 77 employees that could potentially qualify for Medicaid, we see a bar right next to them, or right next to the blue bar in red and green. And the red portion represents the amount of premium and out-of-pocket expenses represented to that particular population within the exchange, or in this case within Medicaid. So you see a very small fraction of the cost compared to the existing employer-sponsored coverage. You also have an impact in green listed as additional taxes. It's important to know that employees' out-of-pocket expenses and their premiums can be paid for on a pre-tax basis. Moving forward into the exchanges, any premiums and out-of-pocket expenses will be paid on an after-tax basis. So it's the combination of the costs in the exchange as well as the estimated tax impact by no longer paying for the out-of-pocket premiums and expenses on a pre-tax basis. So then we move into the federal poverty limit of 139 to 250%. So these are employees that would qualify for subsidy within the exchange. So everyone under 400% federal poverty level will qualify for some level of subsidy within the exchange. It is based on a sliding scale. So the closer an individual is to 100%, they're going to see the greatest amount of assistance. Those individuals nearing the 400% of the federal poverty level will receive less subsidy on the exchange. So in this particular example, you compare the blue bar representing the out-of-pocket expenses and premiums paid by the employees for the employer-sponsored plan, and compare it to a silver-based plan, so a 70% actuarial value plan in the exchange, and you see it's pretty much of a wash. So the amount of subsidies that an individual receives at that federal poverty level are pretty significant. Then you move over into 251 to 400% of the federal poverty level. While employees are still receiving federal tax subsidy within the exchange, the scale starts to tip, where that tax subsidy that they would be receiving does not offset the out-of-pocket expenses and premiums enough as comparing them to employer-sponsored coverage. And then moving further to the right, looking at the impact to employees above 400% of the federal poverty level. So these are individuals that are subject to the employer mandate, that they pay significantly less under employer-sponsored coverage than they would in the exchange. Their cost in the exchange could be 2 to 3 times more than what they would be paying under the employer-sponsored plan. So as employers look at the financial implications, they'll see that there are going to be increased expenses to the health plan as a result of health care reform. There are also business deductions that need to be taken into account. But as they look at what that would mean to employees, as they shift their benefit decisions or change their benefit design and contributions, it could have a detrimental impact to the employee population. So other factors influencing costs: low plan participation, group demographics, plan affordability, and plan eligibility. So as we look at demographics and plan participation, it's important to recognize where employees are falling relative to qualifying for a subsidy. How many employees are currently participating versus not participating? What's the average age? Are the employees married? Are they single? So these are some of the elements relative to the demographics that we take a look at in our analysis to help employers understand the potential additional costs to their plan based on migration. So as we look at plan affordability, again, this is another part of our case study, looking at a scatter plot. So each box on the scatter plot represents an employee. For those represented in blue, they're currently enrolled in the plan, and for those represented in red, as of today, they're currently waiving coverage. In this particular case, it's important to see that for the most part, the majority of the employees fall in either above 400% of federal poverty level, or if they remain between 139 and 400%, for the most part, all of the employees have what's to be considered affordable coverage. So those employees are paying less than 9.5% of their household income for employee-only coverage in the employer-sponsored plan. However, for those that are above the red line towards the upper third of the page, there are a handful of individuals that would be considered to have unaffordable coverage. And this poses a potential penalty to the employers. So if any of those particular employees were to go onto the exchange, they would qualify for subsidy. And enrolling and receiving the subsidy, that triggers a $3,000 penalty for that employer. Looking at plan eligibility. So in this particular scenario, we had an employer that offered benefits to a small portion of their population, so not the entire population. They had risk considerations of looking at employees working 30 or more hours a week and recognizing that they needed to cover at least 95% of the eligible population. So in this particular case today, they have 88 people covered under their plan in 2013. Moving forward into 2014, there's such a large portion of their population that's currently not eligible for benefits. When we take a look at who would actually qualify based on the 30-hour rule, that number reaches 429 in 2014 and moves to 567 in 2018. So for this particular employer, their costs were expected to go up greater than 500%, just based on the number of individuals that would be eligible for the health plan and selecting to participate. Other factors influencing costs, we talked earlier about magnet plans. Do you have rich benefits and low contributions? Are you attracting people to your plan? Are other employers changing the value of their plan in the amount of contributions? So other employers' decisions will continue to impact your employer-sponsored plan as it relates to employees electing coverage for themselves and their dependents. And then the Cadillac plan excise tax. Do you have a high actuarial value plan? Do you need to consider reduction? Do you have poor plan experience? Do you need to consider wellness initiatives? Initially, when we thought about the Cadillac plan, we thought it would apply to employers that had very rich benefits. So a low or minimum deductible plan, minimum out-of-pocket expenses, small amount of copays that employees were paying with benefits. But what we found is, it's really twofold. So employers who have a very rich benefit design are at risk for the benefit taxes beginning in 2018 if their plan exceeds certain thresholds. But more importantly, employers that have an unhealthy population or a population with significant health risks, they're even at greater risk for the excise tax beginning in 2014. And as we move forward into our next webinar series, we will be talking about the different considerations, outside of benefit design that employers need to be taking into account and consideration now in helping their employees become more healthy and more productive. So plan termination consideration. So you'll hear us talk about kind of the pay or play model. So far we've addressed the kind of the play model. So if an employer were to continue offering coverage, what might that look like? And if they weren't offering coverage, what might that look like for their employees within the exchange? So now we're going to take it a step further and look at the impact of terminating the coverage. So a few factors to consider under plan termination. You have the employer tax status. This becomes significant because you're either an employer that is exempt from federal taxes or you're paying federal taxes. And that comes into play when you look at how benefits can be deducted as an employer expense, and how might those tax implications impact your decision? What would the penalties be under plan termination? Currently, for those employers that can take advantage of the tax deduction, employer-sponsored coverage, or the cost of employer-sponsored coverage, is a deductible business expense. The penalties that an employer would pay, whether exempt or non-exempt, are not tax deductible. We'll talk a little bit more about the employee impact and then business objectives. What do you need to be considering as a business when you look to make this decision? So we're going to look at two different plan termination examples. The first, we'll take a look at a tax-exempt entity. So looking at the employer's kind of pre-reform costs. So the expected plan cost in 2014 in this particular example was $3.8 million. When we factor in the cost of healthcare reform at about $200,000, again for this particular employer, the total impact of just over $4 million. So if they were to eliminate that impact, they would have a penalty for not offering coverage. The penalty beginning in 2014 is $2,000 per full-time employee, less the first 30. So you're getting a pass on the first 30. So for this employer, they would pay almost $1.2 million in penalties. So as a result of that, the total change in cost is almost $2.9 million. Then in terminating the health plan, you also have to consider today employees pay for health care coverage on a pre-tax basis. So in eliminating that pre-tax deduction, you have a slight increase of payroll taxes. So in the end, if this particular employer who's tax exempt were to consider plan termination in 2014, we would estimate that they would save about $2.7 million. This does not take into consideration any type of salary adjustment that the employer might consider because of the loss of benefit to the employees. So now we're going to take a look at an employer that can take advantage of the deductible business expense and would have additional tax implications. So for this particular employer, they have a pre-reform cost of $2.5 million. The additional healthcare reform impact of about $157,000, totaling about almost $2.7 million. If they were to discontinue offering coverage, they would have penalties totaling $828,000. Again, that's that $2,000 penalty times the entire full-time population less the first 30. They too see the change in payroll taxes as a result of losing the pre-tax contributions that the employees were making. But they also have a $1.1 million change in corporate taxes. So they're losing a deductible business expense. So all in for this particular employer, again without salary adjustment, they would serve to gain $617,000. Now some might see that as a gain. When you look at the impact to your recruiting and retention and should you want to be an employer of choice, oftentimes that number doesn't look as favorable. So when you take into account if an employer were to consider terminating coverage, recognizing that they're eliminating a benefit, what might it look like if they increased the employees' salaries to quote-unquote break them even? In the analysis that's performed, it's important to consider all of the entire population across the federal poverty levels. You'll have some employees that qualify for Medicaid, and therefore they wouldn't be losing relatively any benefit from the employer. Then you would have some of those individuals qualifying for subsidy, so the amount of a salary increase to those individuals would be less. You'll see the greatest impact to those over 400% of the federal poverty level because they do not qualify for income tax subsidy. So those are the individuals who would need to have an additional salary increase to break even. So in this particular case, if we look at the employer savings from the prior page of just over $600,000, if you were to look at making the employees whole to a 70% benefit plan equaling a silver plan within the exchange, there would be an increased salary amount of just over $3 million. As a result of that, you have a change in payroll taxes. The more salary an individual receives, you have different FICA taxes and other taxes that are applied to that. But that's also a deductible business expense. So employees' wages are a deductible business expense. So in this case, the employer had a not necessarily an equaling balance, but they increased the salary, they paid more in taxes, but then there was a small savings in their corporate taxes. So as they look at the total change in cost post-tax, so factoring in what they would save by terminating their plan, considering the penalties, and then factoring in what they would need to increase employee salaries to be to make them whole under the 70% actuarial value plan, they would in effect be paying $1.4 million more than they would have paid should they decided to consider cover, or should they have continued coverage. So I know that that's a lot of information. I think what's important to recognize is that PPACA has interrelated moving parts. So you have the compliance, you have the financial impact, Medicaid expansion, exchange options, the value to employees. All of those things change as plan designs are changed, as employer decisions are made to increase contributions, to terminate health plan coverage. And it's important to take a step back and to take a holistic view at your employee culture, the value of the benefits to your employees, your population. Are they lower paid? Are they falling above 400% of the federal poverty level? How might healthcare reform impact your organization? Are your benefits rich? Will they be below the thresholds for the excise tax in 2018? All of these considerations need to be made or need to be considered, not necessarily in a vacuum, but on an ongoing basis to make sure that constant reevaluation is being applied. The penalties beginning in 2014 are only going to increase. Plan costs are going to continue to increase. The costs within the exchange are going to continue to increase. So it's important to recognize that a strategy put in place today, it's not something that you can put in place and walk away from. It's going to require constant evaluation. So which path will you choose? Will you play using new rules in a new playing field? Will you exit? Will you pay the penalty and get out of the game? Or will you maintain status quo? Unfortunately, I think what we've demonstrated today is staying status quo really isn't an option. Employers have to take action. They need to consider company culture, the value of benefits to employees, recruitment, retention, compliance, business strategy, wellness focus, demographics, trend migration. All of there are many, many implications that apply regardless of path that you choose. So just a few final comments. Healthcare reform is not just a compliance issue. It's really taking things beyond benefits and becoming more of an operational and overall business decision. Understanding how healthcare reform and the risk factors could impact your organization. Employees need to understand the financial ramifications. What better way to help your employees understand the value of your programs by helping them understand the cost within the exchange compared to employer-sponsored coverage. Quantifying and communicating the unique risk factors of your benefit plans to develop a strategy will be critical. Again, it's not something that can be made into a vacuum and does require constant reevaluation. Our next webinar series, Building Your Healthcare Reform Strategy, is scheduled for March the 13th from 9:30 to 10:15. We'll be covering how you eliminate risk and maximize the value of your employee benefit programs, evaluate the tools needed to establish a timeline, outline your communication strategies, and aligning your healthcare reform strategy with your business goals and objectives. We thank you for your time today. We encourage you to visit our website and to see the additional resources we have available at www.apexbg.com. Thank you.